everyone, and welcome today to our webinar. We're going to be talking with Monogram Health about building for scale. And I'm Michelle Blackmer. I'll moderate the conversation today, and I'll let the speakers introduce themselves in just a minute. Before I do, I'll cover a few housekeeping items. We are recording the webinar today. We'll make a copy of the recording available to everyone who registered within 24 hours. We have activated the Q&A panel in your webinar screen, and so you can ask questions at any time through that panel, and then we'll field them throughout the webinar. If by some chance we miss your question during the session, we'll follow up with you directly afterwards. And then, of course, in this virtual world, we are all broadcasting from our homes, and so you might hear a dog or a cat in the background, and hopefully that makes it more relatable than anything else. And so we will get started here. Before I hand over, I'll quickly let you know what we're going to talk about. Today we will talk about how Monogram, and specifically how Cameron thinks about making a buy or build decisions, considerations that Monogram Health took into account, why they chose Rhapsody, what their experience has been like so far, some tips and learnings for other people in the audience, and then a little bit about what's next. And why don't I have the stars of the show, Lori and Cameron, introduce themselves now. Cameron, will you go first?
Sure, yeah. My name is Cameron Kerber. I'm Vice President of Application Development here at Monogram Health. I've been here almost a year, and I've been in the health tech and biotech industry for about 20 years.
And Lori?
Hi, my name is Lori Lauritzen. I'm an engagement manager here at Rhapsody. I've been with Rhapsody for about 2 years, and I have a project management background. I've been managing projects in healthcare IT for over 25 years.
Terrific. Well, I'm looking forward to the discussion, and obviously from the prep, I know what's coming, and I think it's going to be really beneficial for people listening to the webinar. Cameron, tell us a little bit about Monogram Health and what you all are doing as a company, and also what your role is, what your team does, please.
Yeah, great, thanks. So at Monogram, our mission is to transform the way healthcare is delivered for those with kidney disease, so they can lead healthier, happier, and more fulfilling lives. We're leading value-based provider of in-home evidence-based care and care management services for patients living with polychronic conditions, and a focus on those with chronic kidney and end-stage kidney disease. We have a unique integrated provider services approach, so we can treat complex chronic conditions, emphasizing conservative and palliative care options, while improving access to affordable care in the communities we serve. My team at
a mix of software and people, right? Like you have.
Yeah.
Okay.
Correct. We have a lot of we have a large staff of providers or clinicians on staff. You know, a mix between care managers, social workers, nurse practitioners, specialists, medical directors. So we can really provide that interdisciplinary clinician team to being able to be responsive to the needs of our patients. It's a good question. So for the application.
Oh yeah, go ahead.
Sorry.
I was like, wait, that is really interesting, but yeah, tell us also about your team. Thank you.
So the application development team here at Monogram, we focus primarily on any of the applications our end users interact with. So primarily our clinical users, right? So where they are charting about our patients or utilizing data to intervene and know when to intervene with patients for our call center. Or for the patients themselves, you know, the applications that we provide to them to interact with. We have a team that's comprised mostly of developers, administrators, analysts. We're just like kind of our clinical team is for this in-home healthcare that we're providing at Monogram. We're very distributed. So most of our team is, you know, across the United States. And we've really leaned into the kind of remote work operating model. Allows us to draw from a larger pool of talent. It's worked well for us.
Awesome. And Lori, tell us a little bit about your role and your team here at Rhapsody.
So as engagement manager, it's my role to manage the partnership between Monogram and Rhapsody. So that means that I pretty much take care of everything Cameron needs, whether it's, managing the various long list of projects that he has going on, making sure that we resource things appropriately, pretty much, act as his one, main point of contact for everything he needs. So he doesn't have to go bouncing around the organization looking for assistance. And our team is a variety of implementation architects, both in the Envoy Rhapsody world and then also in EMPI.
Okay. And really working with customers like Monogram, helping them as they're growing and navigating the complexities of healthcare data.
It's a lot of fun.
Cameron, it sounds like it. And thank you for doing that great work for Rhapsody too. Cameron, when you think about, like, as you described Monogram, it's obvious that you'd be growing and plan to grow significantly in coming years, given the dynamics of the healthcare delivery today. So as you're starting to scale and continuing to scale, how do you think about philosophically, buying or building software, making that decision?
Good question. So I try to keep it fairly simple, at least philosophically, as you described. So we really build where we want to differentiate as an organization. So it's primarily with our patient experience, our clinical workflows, and our data insights. That really allows us to personalize the experience both for the patient, but also for the clinician, right? That is working with these patients, especially across that interdisciplinary team that we described, really providing the right insights to our providers at the right time. So that's where we want to differentiate, and so we will build solutions to support that, and then we look to buy wherever we can accelerate features to market, utilize expertise we do not have, or provides a solution to scaling that might take us too long to get there ourselves.
That makes sense. And I know we kind of talked about this webinar at the start as focusing on identity, but throughout our prep and throughout today, we'll talk a little bit about both integration and identity, because Monogram is using Rhapsody for both of those solutions. And so I guess in both of those cases, Cameron, you sort of looked at, here's where we're going to differentiate. And then when it comes to integration and identity management or master person index, those are two areas where the tech and expertise existed outside of Monogram. Is that, what made you start to realize, like, hey, integration and master person index are two problems we need to solve?
Yeah. So I think with anybody's kind of IT strategy, they're going to be doing some type of integration. And nobody's probably building an integration strategy from scratch. So it's just kind of a layering, kind of up the stack, I suppose, if you will, meaning you could utilize services from the major cloud providers. That'll get you some of the basic infrastructure to implementing a lot of the integrations, or you could kind of move up the stack and move more into thorough software solutions or managed services. And given where the size of as a startup, for how much we wanted to develop ourselves versus having a managed service, we looked at it. It was appropriate for kind of the size and our current scale as a company to look at a managed service that could augment both the hosting of the integration environments, but augment also the development of those integrations. Your teams has the expertise with that, and therefore we'd be able to scale to being able to accomplish, multiple integrations faster, as well as just, again, leverage that expertise that you have. If we're doing an ADT integration, which is pretty straightforward, but your team's already done that, probably thousands of times over. And so we don't have to, do it for, the fourth or fifth time, where we may have had that experience. We can really leverage your experience in that case.
Funny, because you're pretty, when we prepped for this, you mentioned you've done integration for many, many years. You sort of came into this role knowing what that challenge would look like.
So,
okay.
Yes, just add some color to that. So I've been, like I said, integration is already kind of always a core to your strategy. So ever since I was an engineer working right out of college 20 years ago, we were doing some sort of integration, and we working for a healthcare software solution at the time. We were using Rhapsody, but on on-premise instance. So we were managing the software, we were writing the integrations. I'm sure a managed service offering wasn't even available at the time. But we developed it and managed it, and as we grew as an organization and technology matured and healthcare industry matured, I noticed, there wasn't a lot of value in us having ownership. With that portion, we could really utilize the leverage of an organization like Rhapsody to scale that.
That makes sense. Okay, and then that's very helpful from an integration perspective. And then for Master Person Index, I think sometimes organizations will kind of think they can maybe make it a while before they need to think about a third-party Master Person Index. What was kind of happening for you, or were you anticipating that led you to pursue a Master Person Index?
So, Monogram was founded about in 2019. So, it's come 4 or 5 years later, we are really investing in a solution from Rhapsody or around this. But until that time, we had, built out our own kind of solution, if you will, for that. Because again, as a smaller company with less patients that you have to manage, there's less chance of duplication. It's a startup, so everybody's wearing lots of hats, and you're working through your processes and figuring that out. As we started to scale, and we have new problems and new areas that we want to invest in, we're looking at, well, do we really want to continue to maintain not only the software or our internal software for doing that mastering of patients in our case, but besides the software, do we want to also do the curation, the work around all the downstream challenges of, okay, now I've found a duplicative patient. What do I do about that? How does that process get outlined? Who can support that? Or it happens to actually make it to our operational systems. All the downstream processes that have to be supported to then reconcile that. Now you've got this in your operational systems, and so you got to resolve that. And so we really wanted to reduce all of those risks. So we wanted to remove the ownership of the maintenance around that code, and as well as enhance it. So we didn't, we had some basic checking, obviously, basic probabilistic checking around our master patient index. We wanted to have better tooling that supports who's potentially duplicative as a patient, and we wanted to really reduce any of those patients making it to our operational systems, because that's when there's the largest amount of overhead, right? Because that's the last place where it goes, and then you've started creating additional counts and additional data about these patients that now have to be cleaned up and reconciled. So just really wanted to reduce that. And so that's really why we wanted to make that investment as we've, really started to scale and grow our business.
Yeah, that makes, I mean, I applaud you for thinking ahead about that. What kind of considerations did you give for buying a master person index? Like, how did you think about the business case, the ROI? Obviously, you mentioned reducing clinician burden, which is something that I imagine was paramount, but what other factors came into play?
Yeah, so we have to, some of the things we just spoke about. So the responsibility for the time to build and maintain or upgrade any of the infrastructure that's supported of it. The level of troubleshooting that one has to do associated to these costs. And again, that's something our IT team could take on, but probably not the best use of our time when we talked about where we really want to differentiate either in that patient experience or those clinical workflows. That's where we want our team members spending the majority of the time. And so when we talk about that return on investment, you have more of the operational costs that are pretty clear around what it costs you to maintain your own environment or infrastructure to support that. But then there's the opportunity costs that are lost because you're not spending your time really advancing the business or advancing your mission.
What you do, right? Like also your roadmap sort of slipping to the detriment of it. And did you look at kind of how did you select a vendor? Did you look only at best of breed vendors, or did you give consideration to?
We looked at a number of different vendors in this space, both for EMPI or integration. First, we tend to look at our existing vendors and see what type of, knowing that we need these capabilities. So if we've already made it that far, we tend to at least start looking at our existing vendors to understand what they have, because, right, the flip side of buying solutions, right, is now you potentially have a lot of vendors that you have to manage and support. And so if we can limit that sprawl, for lack of a better word, then that makes the management a lot easier, especially if you have a really good relationship with that vendor and, and they can really meet the capabilities that you're looking for. And in this case, for the EMPI, we had already been utilizing Rhapsody as our vendor for integration. And so we had that working relationship. We really, and which was actually working out very well. We knew, the individuals like Lori and her team that we've been dealing with on a really almost like a day-to-day basis, because we're trying to do so much on the integration space. So we knew that they were committed to us, that we'd have the success that we want, and that the capabilities were there for the EMPI. We were looking for something that provided probabilistic and referential data matching. We looked at 4 or 5 different vendors in the space, and as we started looking at it based on capabilities, price, and that kind of that known quantity factor, it was really quickly landed to the Rhapsody team.
I think you were interested, I'm trying to remember, hopefully I get this right, but you were interested in augmenting your data too with with third-party data, and then being able to maintain that in the data model. Was that important to you? Or
yeah, that was really in our capability list. That was kind of a differentiating thing that we wanted. So being able to augment our patient information with additional data attributes associated to our patients so that we could utilize that for better insights or potential outreach to our patients was really helpful. And so having that coupled to the solution, made it much more appealing and helped again with our ROI for our business case.
Yeah, that makes sense. And Lori, obviously Cameron mentioned like reducing vendor sprawl. There's benefits to the customer working with a vendor that they already have a relationship with. For your team, you mentioned that Monogram are like integration rock stars. Has like having that relationship made it easier for the Rhapsody team as well to support Monogram, or how has it made it easier?
Yeah, we had the relationship doing integration with Envoy early on, and learned really quickly how Monogram operates as far as how they run their projects, how many projects they like to run at the same time, what their needs are. We watched the pipeline really closely. So we had already established all of that relationship when EMPI came into the picture. So, really it was just adding another meeting to the calendar, bringing in some other subject matter experts, our architects on the identity side, and just rolled with it. And, it's just another project in Cameron's portfolio of things that he's got going on. So we saved a lot of time and weirdness with, the whole storming and norming part of any project. So yeah, it was good.
Cool. Okay, and then Cameron, has it, this applies to identity and integration. And I think, I always think having the integration working makes the identity piece go so much faster, because getting the data into the master person index is often, in other implementations, I've seen that be a challenge. What types of integrations are you doing, and has that helped the master person index implementation accelerate? I know you only recently went live on the master person index, but what types of integrations do you have in play?
Yeah, so we're doing a lot of integrations, as Lori could attest to. We've integrations for us, we primarily kind of have two facets of it. So we have it either, well, maybe three facets, I guess, externally with vendors, so other data partnerships that we might be looking to achieve, externally with other customers, and then internally where we might be exchanging information between our different internal clinical systems. So when we initially launched, we focused a lot internally. So we primarily utilize Athena's EMR. We have Salesforce, some other systems, but we really wanted to improve the efficiency between those two. And so we spent, the first few months of working together around that, and looking for, quick wins, and then finding, the best way to improve clinical workflow. And then we really wanted to leverage, again, the expertise from the Rhapsody team and drive towards improving some of the data flow with our external customers. And so again, when we talk about like admission feeds, ADT feeds, so knowing when our patients, which are very sick patients that often go to the hospital, knowing when they're in the hospital as early as possible is very important to us. So the more kind of real time we can make that notification between us as a customer, between our customers, really helps our patients. And so adding Rhapsody into the mix kind of just added another tool to the toolbox in our relationship with our customers, because then instead of certain either flat file ingestion or other types of ingestion, we could now add real-time HL7 integration. And so that's really been a boon for us. And then we could take that and start to leverage that with other additional data sources. So just sticking with the ADT example, now we can have easy relationships with different health information exchanges, with different state HIEs, to being able to also ascertain notifications as patients are going in and out of the hospital. And so we were able to really reuse that kind of base integration for admissions, but then have it pointed to either different customers or different vendors or partnerships for layering that.
So then in that way, it speeds the time from like the time they agree to be a customer or partner till you go live. Has it accelerated that? Okay.
Yeah, exactly. And it's just made it, again,
do they see that benefit? Like do they realize that or feel that benefit, or do you think it's just remove the friction and so they don't really have to notice?
From a customer standpoint or our clinician standpoint?
Yeah. Well, both.
So from a customer standpoint, I mean, you need options when talking to customers, right? Because you don't, there's going to be lots of different ways that you're going to end up trying to work and onboard a customer, and everybody has different preferred approaches. And so just having another option, and this one being very seamless, provides quick to market, kind of a quick to market ability. And then with our clinicians, they've definitely noticed that it really just provides, again, more of that real-time data feed versus something that might take a day or two because of a different interoperability pattern that has more hops to getting the information into our systems. So it's definitely advantageous for us, for sure.
But hopefully, I mean, as you're answering the question, I'm thinking if it's all going well and the integration and the identity are working together, the clinician shouldn't even realize. I mean, it's just a good experience for them, right? And they don't even.
That's right.
If they see a problem, it would be a problem. Yeah.
That's right. So the integrations in EMPI from a clinician perspective, you probably really only hear about it when things are going wrong.
Yeah, right.
Right?
So if no one's calling you, things are good.
Right. Exactly. And having, again, kind of Rhapsody as our existing integration made it really easy to onboarding our EMPI, because that was the mechanism or the tool that we could use to drive, okay, how do we get our member or patient data from our systems to being able to be shared with that EMPI, and then that information to being shared back. With that in place, that just made that really seamless, and again, just has that single team that we really need to go to being able to pull it all together.
That's really nice. And then now just a little bit about the kind of your decision in choosing Rhapsody. You shared why earlier, but were you able to make that decision as a technologist, or did you have to get, I imagine looking at the audience and the different participants, and often I hear from people, well, I understand why we need to do this as a technologist, but I have to get the CFO on board, or I have to get my manager on board. Was there anyone else that you had to bring along, and any best practices that you'd share with kind of your peers or other technology folks in the audience?
Yeah. So with the integration strategy, it was a little more straightforward. So I don't think I'll talk about that one too much. And straightforward meaning, again, integration is like a standard capability that you need at some level in your application stack for almost any IT shop. So it's almost a given to some degree, and it's really, it's got kind of behind the scenes glue that makes everything occur. With EMPI, my team, as the application development team, we were really more of the downstream systems, but we could see kind of the challenges and the opportunity of why EMPI would be a good solution, right? So we're responsible for those clinical systems or call center systems, being downstream, that if there was a duplicative patient that made it to that system, then we're hearing the complaints, right? Like you mentioned, like that's when we're getting the calls. So we knew we wanted to better that process for us, but really a lot of that, the responsibility of identifying those duplicative patients fell with our data teams. And so we really had to bring them along. And so we, again, kind of aligned initially on, okay, let's agree that this is a problem and a space that we can improve upon. And, there might be some hesitation around, well, we can build it, right? As an engineers, and I'm an engineer at heart, so we always feel like we can build it ourselves. It's pretty natural. We can always do it better than everybody else. And sometimes that's a hard thing to break away from. But in this instance, so we had the at least initial conversation around, all right, let's set up the problem and what we could do to address it. So then we started having, right, the discussions with potential vendors and seeing really and kind of reaffirming that the capabilities that these different vendors have really outshine what we could build and where we really want to spend our time. And so bringing, the different stakeholders along as part of that change management process and bringing them in early was really important, because if we went off on our own as our application development team and tried to contract and bring this in-house and then said, kind of at the last hour, okay, team, data team, like now you got to send your data here, and this is why, and it would have been a lot more of a difficult conversation and difficult to get the buy-in and then difficult to get the outcomes that you're looking for. So I guess my advice here, as obvious as it might seem, is just to bring in your change agents or stakeholders early and often.
No, I think that's really great advice, because you're thinking about your change agents. Who are they? Is maybe something that sometimes people can charge into a project and not consider who those people might be. And then we talked a little bit about why Rhapsody, and you mentioned managed service, but what has been your Envoy experience? Like, has it, with all your experience in the integration space and doing integration your own, you kind of had a vision for this managed service model, and then has it met your expectations, and how's it work?
Yeah, it's been great, honestly. This is my first time using a managed service for this offering, so there was some hesitation. I won't say there wasn't. Again, can always feel like we can do it better. But the Rhapsody team has been really, again, kind of committed and responsive. We've had the same team since we started with this group almost a year ago, which is very meaningful, right? Like sometimes you work with vendors and you get a lot of churn and the team members you're working with, which, there's always things that come up, but then you have to kind of re-explain, and there's a knowledge loss that occurs with that, and so that's been really impressive. There's also just been the commitment. We work with the Rhapsody team definitely on a weekly basis, I would say almost on a daily basis, because we always have something else we're trying to improve or engage upon. And so having that high level of commitment is the other portion, because sometimes when you move something to a managed service, you might be concerned about the responsiveness, like, oh, I want to add this other integration, let me slot you in for 2 months from now when I can get to it. my team, but we haven't experienced any of that. Always been responsive, and I found a way to make our needs work, I guess, amongst all their other customers.
Thanks. And Lori, I'll give you a chance to talk about you and your team. What's your philosophy? What's your approach? What's really setting Rhapsody and the Envoy team apart?
First of all, I think it's the level of expertise that our team brings to the table. Our architects have a ton of knowledge, and they have different knowledge from different backgrounds, which provides like this really rich base of knowledge. And like Cameron said, it's not a bunch of robots that are just coming in and out of the picture. You know, there's that level of commitment, and it's one team, really, is what we want to be, is one team, not your team and our team, one team, because this is a partnership, and it's our responsibility to help make them successful, whether it's helping build out the applications or having our integration folks, our experts, come in calls early on with their prospects, or however we can support them. You know, we do what we need to do. So it's been a great partnership, and it's been ideal. The other thing that's wonderful about working with Monogram is that Cameron comes to the table with each of his initiatives with a clear use case, a clearly defined business, problem that they're trying to solve. Subject matter experts, both clinically and from the technology side, to solve those problems. So it makes working through all of those projects really nice, because they get things done, and it's really wonderful to see that success.
That's awesome. And I think, Cameron, you started to talk about this a minute ago, but it sounds like you and your team are really proficient, or perhaps purposeful, in thinking about how you break the problem space down into a manageable project to move forward. Is that sort of your personal philosophy that you brought into this project?
Yeah, absolutely. I almost any project that I work on, we try to figure out exactly how you mentioned, breaking that problem space down to how we can get early feedback and early value for our business. That also allows us as a technology team, so one team, being able to discover those technology hurdles quicker, right? Just kind of following that agile mindset. So one of our internal applications that we integrate with has their own validation process for when we're doing a new integration. And so by breaking that problem space down, we were able to, for very first integration, to go through that validation process quickly, which was important because we learned more about that validation process and how long it takes. And then therefore, when we go through the next one, we can account for that or find ways to optimize it. So I think it's always important, both from the business perspective of how you can deliver value quicker, as well as from a technology perspective, because you will always find a lot of the hurdles right in the last hour trying to get something to production. And so the faster you can uncover those, the less risk you take on.
Love it. And as we get to the end of the webinar, is there anything that we haven't talked about that you're like, oh gosh, I think for sure people need to know this or need to be thinking about it?
That's a good question. I think we've covered a pretty good amount today. I feel pretty good.
Feels like we've covered good ground. I feel good for the audience here. What's next for Monogram? What are you going to tackle next?
Good questions. So from a business perspective, we have a lot of growth. We have a lot of new customers. So we're, actively adding, thousands and tens of thousands of patients to our service to manage, which is great. We're also really leaning into driving and focused on patients with polychronic conditions, and ensuring we have an employing specialists that can really, again, kind of really round out that interdisciplinary team and make sure as a patient, Monogram can support you. You do not have to, you know, have all these different referrals to different healthcare providers, and feel like there's gaps in care because of that. We can really kind of envelope you as a patient and providing that services. And so what that entails for our application development team are a lot more, you know, data integrations. Really, again, how can we find other ways to use data to drive insights? And so that also provides new customers and new integrations in that space. And then really just, again, continuing to optimize that clinical and patient experience. We're spending a lot of time on that this year.
Patients get referred into Monogram. I mean, if someone's on the phone in the webinar and they have a relative that has kidney disease, can they like opt into Monogram, or it really has to come through an insurance or provider?
Yeah, that's a good question. We have certain payers, like you mentioned, and different provider groups that we work with, and there's a shared kind of identification of those patients that we manage. So I'd recommend that they talk with their either provider or look at what services their insurance might be offering. But that's how patients come to us.
I was curious about that. All right. Well, thank you. We've fielded all the questions from the audience and that we plan to talk about, I think. And so I really appreciate Cameron and Laura, you joining, sharing your experience, and I hope you have a really terrific day. Take care. Bye, and bye to everyone in the audience.